Pavitra Entertainment presents.
Hello all of you, I am Dr. R.K. Jana, Professor and Head, Department of Clinical Hematology, SCB Medical College, Cuttack, Odisha and India. I welcome you all to this program. You know we are going to have one of the prestigious events in our country, that is 3rd Sickle Global Congress on Sickle Cell Disease and Bone Marrow Transplant, which will be held in Hotel Mayfair, Bhubaneswar, Odisha, India, during 21st to 24th February 2017. You will be happy to know this Congress, this World Congress, is being held in India for first time in India, that in Odisha and in the city of Bhubaneswar. The whole world is converging to this World Congress. About 500 experts in this field from different parts of the world, along with 1,000 delegates from different parts of India, many patients, NGOs, and all stakeholders in this sickle cell disease, they are converging to Bhubaneswar. They will be discussing the various aspects of sickle cell disease, their clinical manifestations, early diagnosis, proper management, how to take a preventive measures to control its incidence and complications in the whole country. And besides that, there will be also participations of health administrations from our 4 neighboring states like Maharashtra, Gujarat, Chhattisgarh, and Government of India Health Department, along with also the Indian Council of Medical Research and many other health professionals are conversing. They will be discussing to formulate a roadmap, a policy which can be implemented in the whole country, including the Odisha state, to have a comprehensive control management of this sickle cell disease, along with other hemoglobinopathy disease like thalassemia. Today, we are very glad, we are very fortunate to have a very eminent person. He is called Professor Issac Odame. He is a professor and chair of hematology department of University of Toronto, Canada. He is the main man who has conceived the idea of Sickle Global Network. Its objective is to control and manage comprehensive management control of sickle cell disease around the world. We are very fortunate to have him. Now let me introduce this great man with a great passion and commitment to control and to help these people who are suffering from sickle cell disease. Please welcome to this program our most prominent, most important guest is Professor Issac Odame. Issac Odame, please welcome to India and Odisha. And my first question is that, what is your vision? What was your idea and vision in conceiving and formulating this Sickle Global Network? Please tell us.
Thank you very much, Professor Jana. Sickle cell disease is a genetic disease that affects a significant number of people across the world, most importantly in areas of low resources, particularly in Africa, India, and places in the Caribbean and South America. Because these countries have low resources, the impact of this disease on these countries is phenomenal. And outcomes of patients born in these parts of the world is not what it ought to be. It's far from optimal. There have been advances and strides made in sickle cell disease, particularly in richer parts of the world. And while a child born in North America or Europe with sickle cell disease has over 95% chance of becoming an adult, the situation is totally different in sub-Saharan Africa, where nearly 80% of children born with sickle cell disease will not live to their 5th birthday. So the contrast is so big, and the whole idea of the Global Sickle Cell Disease Network was to promote and foster partnership and collaboration between sickle cell disease professionals in the richer parts of the world with their counterparts in low resource settings to be able to facilitate and accelerate the process of collaborative research, education, training, and establishment of clinical programs that improves outcomes of patients. And so the network is to create North-South and South-South partnerships between sickle cell disease professionals to make sure that we establish research initiatives and develop clinical programs that find solutions that are affordable, sustainable, and that work in these communities. So in 2009, we gathered in a small country called the Republic of Benin in West Africa, and we decided that we will form this global network for which I became the medical director. Since then, we've met in Ghana for the first Global Congress in 2010. We've met in Brazil in 2014 for the second Global Congress. And the third Global Congress is going to be held in India. India, because India has one of the highest and the heaviest burdens of sickle cell disease in the world. And we wanted to highlight the problem of sickle cell disease in India and to showcase a lot of the work that is being done in India to combat this disease, and also use this as an opportunity to bring momentum and catalyze the whole process of finding more effective solutions that optimizes care for patients, bringing new technological advances that make diagnosis of this disease much more affordable, and also to think of preventive strategies that will be the future in reducing the burden of sickle cell disease in India, and particularly in Orissa, because Orissa has one of the highest incidences of sickle cell disease. And we think that by bringing the Congress to Orissa, will be helping to really emphasize the need for optimal programs to improve patient outcomes. Ultimately, it's the patient who should be at the center of this. We want to make sure that every patient has access to early diagnosis, early treatment, continuing treatment with drugs like hydroxyurea that have shown effectiveness in controlling this disease, and that they are supported enough to have good quality of life, to be able to have good education, good access to jobs, and to be able to contribute their quota to socioeconomic development of Orissa. So we are very happy to be here, and we want the whole world to know that sickle cell disease is making progress, and that patients with sickle cell disease need not suffer social isolation, they need not suffer discrimination from work, but that they can live good quality lives and they can integrate into society and be successful members of our society as well. So thank you very much for this opportunity, Dr. Jenna and your team, for being ready to host this Congress, and we are looking forward to a very fruitful Congress.
Okay, that sounds very awesome, that we have a very innovative objective and motive to create this Sickle Global Network and this World Congress, that too in India and Orissa. My second question will be that we would like to know what you have achieved so far and what are the challenges you are facing to so far meeting your target so far the world is concerned, or the world scenario is concerned.
So sickle cell disease is a disease that has faced a lot of challenges in terms of research and resources to combat this disease. And that is primarily because the disease is mainly prevalent in parts of the world and societies with low socioeconomic resources. And so with that, the needed investment that needs to be committed to sickle cell disease has taken some time to really come to fruition. But the situation is changing. There's been real strides made with early diagnosis through newborn screening, good prevention of early deaths through penicillin prophylaxis and vaccinations, good treatment of the disease with hydroxyurea and chronic blood transfusions, and now curative therapies are emerging, including bone marrow transplantation and clinical trials involving gene therapy and gene editing. So really, we've come to the time when there is a lot of focus on sickle cell disease, because we think that we now have the tools and the scientific knowledge to be able to tackle this disease. Pharmaceutical industry has also entered the fray in a big way, that there are now several new molecules that have gone through clinical trials that will be targeting sickle cell pain, will be targeting sickle cell organ damage, and will be improving outcomes for patients with sickle cell disease. So the future bodes well. But if we don't act quickly, it means that patients in the richer parts of the world will be advancing while their counterparts in low-resource settings will be left behind. And what the Global Sickle Cell Disease Network wants to do is to bridge the gap between outcomes of patients in low-income countries compared with their counterparts in the richer countries. And by doing so, we'll be removing inequities in health outcomes and helping advance the care and survival and quality of life of patients who live in places like Africa, India, the Caribbean, and South America. So this is what we are hoping for, and this is what we are trying to overcome. The barriers are enormous, and the barriers are because resources are limited, governments are not as motivated in tackling this disease. But we think if we can find workable solutions that are affordable and sustainable, we might be able to change the attitudes of governments, give them the support that they need and the know-how, and all the stakeholders that need to be coming together to tackle sickle cell disease.
And you know, there is another big thing that most of the hematologists or even the physicians also, they don't take up the sickle cell disease as very seriously, because this is a disease of the poor patients. The returns are not, the finance involvement is very negligible. Take for example of your case. You are a hematologist. You are occupying most coveted chair. You are the chair of the BMT and hematology department of University of Toronto. Still you have sacrificed the most lucrative, most glamorous aspect of hematology like oncology, transplantation. You have chosen the sickle cell as your main career like that. And I am observing for last 3 to 4 years, there is a strong passion for sickle cell disease. What could be secret behind this? Why you are fascinated, your passion is strong towards sickle cell disease? Any reason for that?
Yes, I think my authentic story about sickle cell disease is that I've had close family members that have been affected by this disease. My own nephew and niece have passed away early in life from sickle cell disease. And while growing up in school in Ghana, where I hail from, I've seen many friends and distant relatives succumb to this disease. So I have a personal relationship with sickle cell disease in terms of its impact on people's lives. Secondly, I've always committed myself to fighting for the underdog, fighting for the underprivileged, fighting for the people who don't have the voice, fighting for the people who have the least chance of finding solutions to their problem. Because I believe that this is the area that I can make the most impact if I can help lift them out of their gloom and give them a hope for the future. So for me, sickle cell disease is a passionate commitment to fight for those who can't fight for themselves, to give them a voice, for those who are struggling with low self-esteem because of the stigma that are associated with this disease, because they don't get the opportunities that other patient populations get. I want to make sure that I fight for them, and I want to partner with colleagues all around the world who share the same passion and commitment for us to tackle this. It's not going to be easy. If it were easy, it would have been done already. But we relish the challenge that if we continue collaborating and working together, we'll be able to achieve our goals of lifting the burden, reducing the burden of sickle cell disease, and bringing hope to many, many patients who suffer from this disease.
Okay, so do you think that considering the fact that sickle cell disease is prevalent with the very poor people, with tribal populations, rural populations, with early mortality, suffering, their economy is shattered like anything, is that the sickle cell disease has not drawn the attention, the kind of attention that should have drawn from the doctors, from the policymaker, even from the health administration, and from the whole world at large? Do you feel that sickle cell disease group are really neglected and not paid attention by the whole world? What's your view in this regard?
There's no question that it's been a neglected disease, and many manuscripts have been written highlighting the problem that sickle cell disease has been neglected for quite some time. But I have a positive attitude to this. I think we are beginning to make strides. Since animal models have been developed for sickle cell disease, many basic scientists are making successful strides in advancing the basic science of sickle cell disease. There are many researchers who are translating the basic knowledge into the clinic. At the last meeting of the American Society of Hematology, a lot of top-level abstracts that were shared related to sickle cell disease. New pharmaceutical industry partnerships are beginning to develop new molecules that are going to be useful for treating sickle cell disease. One of the hallmarks of this disease, that is pain, that has been very difficult to manage. Some basic science and translational science efforts in these areas are beginning to lead us into areas where we might find better solutions for sickle cell disease. American Society of Hematology has made sickle cell disease a primary focus. at the last American Society of Hematology meeting, there was a special presidential symposium that focused on sickle cell disease. The National Institutes of Health, particularly the NHLBI, has made sickle cell disease a major focus, to the extent that the NHLBI is funding support for a consortium of countries in Africa to support sickle cell disease programs in these countries to be able to advance clinical care for patients in low resource settings. So the climate is changing. There was a long period of neglect, but we've entered an era where now there's renewed focus on sickle cell disease. And you can tell that when Big Pharma now are very interested, that all the major pharmaceutical industries are now developing products in sickle cell disease. So the momentum has shifted, and it's time for all of us to rally around and to be able to support this momentum to be able to tackle sickle cell disease.
Do you know there is another great man of this India, is called Mahatma Gandhi. He's got the name as the father of India. He was pioneer, he's synonymous with fighting for the poorest of the poor.
Yeah.
He fought for many reasons, what was the poor, for the exclusive of poor. He sacrificed his life for that. Are you really influenced? What's your view so far, the views or the ideology of Mahatma Gandhi is concerned? How similar is to Nelson Mandela you find in other countries also?
Oh, I mean, I think everybody who has known the history of Mahatma Gandhi and how he denied himself. He was selfless. The man had opportunities to live an opulent life. He denied himself of that, and his followers also did the same, to be able to fight for the underdog, fight for the poor. And the exemplary life he led is what inspires many leaders in the world, and I have to say it inspires me as well, although I don't think I even I'm able to achieve those standards that Mahatma Gandhi did. But you look at other leaders like Nelson Mandela, who fought for their nation, and he said he was ready to die for those ideals that he was fighting for equal rights for both black and white people in South Africa, and that's what led to the abolition of apartheid in South Africa. And so the principle of fighting for those who can't help themselves, people who are neglected and underdog, is the highest principle of life to fight for. And I think this is what has inspired them, and this is what inspires me as well. I'm not quite sure I meet their standard, but that is what drives me.
Okay, that's great. And tell me, you have visited many times the different parts of India. What is your view regarding India? Are you fascinated by Indian people, Indian culture, places? What's your view, take on India?
India is a fascinating country. I mean, I think anybody who thinks India is homogeneous doesn't really understand what India is. You learn in Delhi, the culture there is totally different. You land in Bhubaneswar, Orissa, the culture is totally different. And I think India is very fascinating, particularly in Orissa. I've found people very friendly, very culturally, very calm people, people who are trustworthy. I think the high moral standards that I see here is very exemplary. And everywhere we've gone, visiting various people in government and policy making roles, the humility I see from people is something that has been very revealing. And then India has many fascinations with their history and their culture, the temples, the beautiful places, the climate, the food is something else. So India is a very fascinating place, and I don't think the world has studied India enough, and I'm hoping that by bringing this Congress here, we'll be able to expose many more people to Indian culture.
So lastly, what is your message to the whole to the whole world in controlling the sickle cell disease? What is your take-home message or key points which you want to tell to the audience?
So my message to the world is that the sickle cell mutation arose as a protection against malaria. But that protection has led to vast numbers, millions of people born with sickle cell disease who are either dying so early in life or are living very poor quality lives. So the benefit of the sickle mutation has been far outweighed now by the negative impact of sickle cell disease. However, with a concerted effort, all of us together, professionals, scientists, clinicians, paraprofessionals, policymakers, NGOs, government agencies, global health funders, patients and advocacy groups, we all need to come together to fight this complex disease. It's a genetic lifelong disease with a lot of impact on organ function and requires a concerted effort to be able to reduce the burden. We need to start from preventive strategies. We need to go on to early diagnosis. We need to prevent early mortality and early morbidity. We need to give people disease-modifying treatments that gives them good quality lives. And we ought to change the narrative about sickle cell disease, that it is possible to live with sickle cell disease and live a high quality life and become very productive and achieve your wildest dreams. The negative impact of sickle cell disease has gone on for centuries too long. It's now time to change the narrative. And we think that science, both basic, translational, clinical science, social science development, all this coming together will be able to give us the tools to be able to reduce the burden of sickle cell disease. We can do it together, but it has to be through collaboration and a concerted effort. And that's what the Global Sickle Cell Disease Network wants to promote. Thank you very much.
So this is Issac Odame, the famous man so far sickle cell disease is concerned, born in Ghana, was conceived or was seen the cousins, relations, friends died of sickle cell disease early, took a voice to take the hematologist career, become the hematologist, got migrated to University of Toronto and is now occupying a coveted post of chair of hematology of University of Toronto, took a challenge to conceive the idea of controlling the sickle cell disease, elevating or decreasing the pain and sufferings of sickle cell disease, conceived the idea of having a world forum called Sickle Global Network, founder member of that Sickle Global Network, with all the aims and objectives of controlling overall management of sickle cell disease in the whole idea, the whole world. With this idea, he has come to this India to organize the third global sickle cell disease and bone marrow transplant in Bhubaneswar with an idea and hope that to create or to present a roadmap which will be followed in the long run in the whole country and Odisha state for the overall control of the sickle cell disease and its related hemoglobinopathies, thalassemia. Thank you very much, Dr. Issac.
It's a pleasure.
Thanks very much for coming to India and bringing this prestigious Sickle Global Congress to our state. Hopefully, your objectives and aims will be achieved. We are with all you. All the best for your endeavor.
Thank you very much.
It's a Pavitra Entertainment presentation.